Okay, I'll speak for 20 minutes or so. Elizabeth will then speak for 15 or 20 minutes, and then we'll do questions. I'll start with just some acknowledgements. I mean, a lot of what I'm going to talk about, which is really quite introductory stuff, but it comes from guidance on systems evaluation that we produced a few years ago now, and it was part of SPHR 2. There was quite a lot of people involved in it. Elizabeth led in it, Vanessa led in it for a while as well. And in addition to that, Elizabeth did a PhD on systems related PhD, and basically a lot of what we have to say comes from these two things, for both of us. So I shall move us on. So, like I say, this is going to be like an introduction to systems thinking and evaluation. We are on the more sort of systems thinking side of things. What we tend to make a distinction, because others have made it, between systems thinking, which is a kind of more theoretical level, and possibly sometimes more qualitative, and then the complexity science side of things, which is more about modeling of one kind or another, and tends to produce outcomes that look more quantitative sometimes. So that's a broad distinction, but actually there's just loads and loads of different approaches to doing systems thinking and systems research in general. So it's just a broad distinction. And I want to flag up that since we did our own guidance, the MRC produced its guidance on complex intervention evaluation. So the new framework for developing and evaluating complex interventions, which we fed into, we attended some special meetings they set up on systems thinking. And in that guidance, which I suggest you all read if you haven't already done so, there's basic sort of definition of what a complex intervention is, which they talk about an intervention with lots of different components, behaviors, lots of different types of behavior targeted, population settings, levels, expertise, lots of different people involved, flexible delivery, so it's not like a fixed plan that they stick to rigidly, things can change over time, and a big issue is how the intervention itself interacts with the context that it's implemented in, and I'll just follow up on that in the next slide, because for a while now there's been a growing sense within public health research that there are kind of two different ways of thinking about complexity. And there's one way which we've been doing for quite some time, and there's another way that other people have been doing for quite some time, but is still relatively new to most of public health. So the way that public health have been thinking about complexity for quite a while is in terms of complex interventions. So that's really thinking of, when you think that something's complex in public health, you're thinking of the programs that people are putting in place, or the policies that people are putting in place that kind of meet the MRC definition of a complex intervention. It's got lots of different bits. It might be flexible in its delivery, it might change over time, it might have a number of different outcomes. And so that sort of way of looking at complexity places complexity very much within the intervention, the thing that's being delivered. But for a long time, there's been a different way of looking at complexity, which has focused on not the actual specific things that you might do, but the context in which you do it in, and the context is imagined as a system. So in this sense, it's not necessarily the intervention itself that needs to be full of different parts and liable to change, but the context in which you're delivering it is itself very complex, and that will lead to some surprising outcomes over time, and basically lots of different changes that you can't predict. At least that's the idea. So two different ways of looking at complexity. One locates the complexity within the intervention, and the other locates the complexity within the system that the intervention is delivered in. Yeah. For an early statement of this distinction within public health, Alan Shields and Sally Hoare have published some early sort of publications basically outlining this distinction. Sticking for a bit longer with complex interventions and really sticking with what I think many of you will find is sort of a familiar framework for looking at complex interventions. This one's been going around since, I think, the 1970s, where a distinction's made between a simple intervention, a complicated intervention, and a complex intervention. And in this simple distinction, a simple intervention is something where it has a sort of a set way of doing it. It's fairly simple to do. And if you replicate what you're doing over and over again, you should get the same results. And the example is like baking a cake. As long as you've got the right ingredients in the right quantities and you do the same things with them, you should keep getting a similar cake each time. A complicated intervention is just sort of an extension of that. Again, it's something that's replicable, and the main distinction is that it's quite technically difficult to do. So building a rocket, or let's say mass producing a circuit board for a computer, something that can be replicated, but it's quite hard. You need a lot of technical expertise. And then a complex intervention is something quite different. It's less predictable, it's unreplicable. Technical expertise might help, but so might experience, people's personalities, favorable environment, and luck, like raising a child. So that's been a standard sort of distinction and a way of understanding what a complex intervention is. It's been here for a few decades now. We've made the point, and for this we use street lighting as an example, mainly because at the time Judy Green and colleagues produced an evaluation on street lighting, and we kind of just took the idea of street lighting and use it to exemplify this. The point we want to make on this slide is that to some extent, whether an intervention is simple or complicated or complex doesn't necessarily entirely depend on the intervention itself. It depends on how you, the researchers, want to frame it or want to see the intervention. And so with street lighting, the argument we put forward here is that you can, if you wanted to, see it as a simple intervention or a complicated intervention or a complex intervention. If you want to see it as a simple intervention, then you can basically look at the basic simplest change that's occurring. So you can see it as an intervention that affects one point of the system, the lights in the street, and it affects them in one way. They get dimmer. So this was an evaluation of how a lot of local authorities are having their street lamps dimmer to save electricity, and for sustainability reasons and also for economic reasons. So you could, if you wanted to, just approach that in terms of, well, it's simple, isn't it? They've got lights, they're making them dimmer. Or you could view it as a complicated intervention, because actually local authorities tend not to have, I'm told anyway, local authorities tend not to have like a dial that marks street lamps, and you can just sort of turn the dial down and suddenly the street lamps get dimmer. It's actually a way more technically difficult thing to achieve for a whole bunch of different reasons. So you could look into the difficulties and challenges of actually doing this technically difficult action. And then you'd be starting to see the intervention as a complicated intervention. It's something that different local authorities can do. It's a technical challenge, it's a difficult technical challenge. But alternatively, an evaluation looking at dimming street lamps could take a more complex view and understand that, and actually to achieve this intervention, lots of different stakeholders and lots of different activities needed to happen, because there needed to be lots of people involved in the actual process of approving and then facilitating the dimming of the street lamps. And in terms of acceptability, the public needed to be got on board, which meant the media needed to be got on board. Various concerns, such as whether it will affect traffic accident rates, whether it really will save money, whether it will affect people's safety. All these get brought into the frame, and suddenly what you start to get is a complex intervention. It's involving lots of different things, and it can go different ways in different areas as well, depending on the context. So the point is that to some extent, the researchers or whoever gets to choose whether to view something as simple, complicated, and complex. Okay, so that's complex interventions. Complex systems, I'm going to go to basically the standard definition by Meadows, a set of things, people, cells, molecules, or whatever, interconnected in such a way that they produce their own pattern of behavior over time. So now we're looking at not simply whether an intervention has lots of bits to it or not, but we're looking at the bigger picture, the context, and we're looking to see whether what's involved in that context, the wider social, political, administrative, and the economy and economic factors involved, potentially. And there's an assumption that it's not only just looking about the bigger picture, but that it's a bigger changing picture if it's a complex system. So you're looking to see how all the different elements in this system might change, respond, and adapt in ways that affect, well, in ways that happen irrespective of whether there's an intervention or not, and in ways that interact with particular interventions. And just to point out that you often, with complex systems, well, we imagine maybe diagrams with lots and lots of arrows and boxes, and it starts to look all like a sort of spaghetti diagram with lots of lines all tangled up with each other. And that's, in a way, that's fair enough, because I think in public health, a lot of systems are kind of like that. Lots of things connect to other things. But in principle, a system isn't complex just because it has lots of different parts to it. It's not complex just because you can draw a map that looks like a plate of spaghetti. A system is complex because those parts interact and lead to the system behaving in ways that can't be explained simply by looking at the individual elements within the system. So in other words, and this is a really old statement, I think this is either Socrates or Aristotle. I'm going to say Aristotle. The whole is greater than the sum of its parts, and that's really the definition of a system. A while ago now, Elizabeth led on a paper in PLOS Med where she outlined many of the different attributes you might find in a complex system. She sort of had a sort of framework. And we don't have time, well, I don't have time to go through all of those, but we will mention feedback, because that does get mentioned quite a lot with complex systems. So this is a basic idea that rather than a simple sort of linear pathway where you cause something and it has an impact, and maybe then that impact has a follow-on cause onto something else. There's an idea that you can make a change, but the change may feed back to your original action. So an example of one type of feedback, which we call amplifying or escalating, is given here. So if you improve healthy food availability, this could encourage people to adopt healthier diets. So that's linear so far. More availability leads to healthier diets. But then more people eating healthier diets could in turn create greater demand for healthy food. So then the market gets more healthy to respond to the fact that more people are getting interested in healthy diets. So that's a kind of positive feedback where you can imagine it kind of escalating. You know, the more people who switch to a new kind of diet creates more demand for healthier food, which creates more people having a healthy diet. And so it grows. Unfortunately, that's not the only kind of feedback. For those trying to change things for the better, there's also a different kind of feedback where you make a change, but then the other part of the system adapts in such a way that it kind of negates or dampens down the impact of your change. So here's an example. Shops start selling more healthy food, but they then find that customers are starting to go to different shops instead, so they start to lose money. So they then go back to selling less healthy food. So the shops started selling more healthy food, this had an effect on purchasing behavior, but unfortunately the effect on purchasing behavior was such that it actually led the shops to give up doing what they were doing. So dampening feedback. I'm going to give an example from my own take on Jurassic Park. It's not very public health, but I think it's a nice example. If you've seen the first film, and if you've read the book, they do actually refer to system science in it. So I think Jurassic Park, I'm guessing that most of you know the idea. It's a theme park for dinosaurs. There's a temporary breakage in the security system because someone's sneaking about doing something, and this causes a problem which then escalates. The problem that it causes leads to further problems, which leads to further problems, and by the end of it, Jurassic Park is in a state of chaos. It was originally in an orderly state, full of dinosaurs in different pens doing what they were meant to do, but it ends up in a state of chaos. And then it actually, further on from that, suggests that what's going to happen next is the park's going to transition to a new state where instead of a kind of manufactured order, there was going to be something more akin to a natural order, you know, kind of nature taking control. So I've given this as an example because it gives you an example of escalation. As a small change in the system then started to grow and grow and grow. And it wasn't a good thing in this case. It caused a huge problem. And it also gives you an example of transitioning to a new state where if things grow out of control to a large enough degree, then the whole system might change into something really quite new. So that's my example of dinosaur parks. Now this example's it's designed to show a different way in which complexity might work. It's the fantasy world of university bureaucracies. I'd like you to imagine a bureaucracy in an organization that just has too many tasks and processes, and they're constantly being changed and updated. There's just loads of these different things that we're expected to do at different times. And if you look at each of these tasks, none of them have been created maliciously. They've all been created to solve a problem and either help with the governance of the organization or help with efficiency or do something positive. So in the diagram, you can see there's lots of little arrows, yeah? These are all my little tasks and processes, and they're all pointing towards efficiency and good governance. But the problem is, there's so many of these tasks, there's so many of these processes that the people working in the organization are struggling to cope with them all. They're having difficulty remembering what they're meant to be doing. They're having difficulty following a chain of processes so that one person does something and then the next person does something to it and then the next person does something to it. And generally, the cumulative impact of these kind of overburden of tasks and processes is creating problems with the organization. It's leading to a big arrow that points to inefficiency and bad governance. So the reason why I've given this example is partly because it kind of feels close to home, but also because I think it neatly shows one simple way in which the kind of elements of a system can push in one direction, but the system effect, the overall system, pushes in the other. So the individual elements are all trying and designed to improve efficiency and good governance, and the overall effect is actually bad governance. Furthermore, if people looked at specific issues, you know, specific problems related to bad governance and inefficiency in the organization, they might still, if they're still thinking in terms of individual tasks and processes, they might still basically see problems and decide that the best way to fix those problems is to change or introduce a new task or a new process that specifically addresses those problems. But if you keep on doing that, all that happens is you get more and more of these little arrows pointing to the left, but the big arrow pointing to the right gets bigger. Yeah. So I'm hoping that just gets across the idea that the individual elements of a system can point in one direction and the system impact can point in another. This is a diagram that I produced a while ago. You can tell it's one of mine because it doesn't look very nice. But it's basically trying to get the idea of a system level impact across. So as a public health evaluator, I'm interested in intervention evaluation. So I've imagined in this diagram, there's the intervention. And because I'm interested in systems, I'm seeing it as an intervention that's impacting on a certain issue related to public health. In this case, I've imagined it's a school dinners intervention, yeah? But because I'm interested in system effects, I know that, let's say, if you make school dinners compulsory or healthier or cheaper, or let's say you change the menu so you can only buy healthy products in your school dinner. This could have a knock-on effect on other parts of the system, such as whether more people switch to packed lunch and whether the packed lunch is full of junk food or not, whether people are able to go to local shops and what they sell, and do they respond by selling cheaper products designed to give school children the chips. Does it have, and if it impacts on the shops, does it mean there's an impact on the local economy? And what do the parents think about this? So I've imagined not just the school dinners itself as the sort of focal point of this intervention, but a whole bunch of, a constellation of things around it that could be impacted on it. And I'm suggesting that in total, the impact of these very different sets of changes across the system could have an impact on the intervention. If it leads to for example, to more children going to the shops, then the intervention may have to take account of that, and there might be a need for a second intervention to make it harder to get to the shops, or to insist that the shops sell healthier products. Or, for example, it could impact on parents' views on what they put in their packed lunch. So there's different ways in which the system level impact could impact back on the intervention. And I also wanted to make the point that in this example, it's actually a simple intervention, in the sense that all I'm trying to do is improve or affect the menu in school dinners, but it still can be viewed as in terms of complexity, because even though it's a simple intervention, it affects an issue that is connected up within a more complex system. Yeah. So this is what I mean by the complexity is located in the system rather than in the intervention itself. So I hope that gets across the idea that a simple change can still lead to complex outcomes, because the complexity is not in the change itself, it's in the relationships between everything else that's connected to the thing you're changing. And just to let you know that it doesn't have to be that way. You can also have a situation where the intervention is also complex. So you get some whole school intervention, some kind of whole food interventions where the people delivering the intervention will try and change all these things. So they might well change school dinners, but might also look to see what they can do with the shops near the school, look to see if they can have any regulations over packed lunch, look to see if they can educate parents. It's possible to have a complex intervention. And then in this diagram, it's a similar sort of setup, really, except on this occasion, the complexity is in both the intervention and in the system. And that's fine. You can look at that. Both of these are valid ways of looking at complexity. I'm checking my time. I think I need to finish up soon, so that Elizabeth can come on. That was mainly the introduction. I think what I'll do is just focus in on what we actually did when we reviewed public health evaluations that took some sort of complexity approach or systems thinking approach. So I think this is in a paper in Social Science and Medicine that, again, Elizabeth and Vanessa are our first authors of. And basically, we wanted to see whether there were any public health evaluations out there that claimed to take a systems approach, and if so, what was the approach, and kind of what role did they play within the evaluation? And basically, we found some different broad types of approach in which systems are introduced in evaluation. There's system mapping, just creating a map, mapping out the system. There's different forms of modeling. There's network analysis. And then we found this sort of miscellaneous bunch of qualitative kind of process evaluations, which we call systems framing studies. And out of all these things, we thought that the qualitative process evaluations, the systems framing, was the least developed, or at least there seemed to be a more kind of ad hoc work going on with them, and that made us think that that was where we would focus our work and try and come up with ways to introduce systems thinking into process evaluations, basically. And that's what Elizabeth will speak to next. And the other point in this table that's probably worth noting is that when we thought about systems evaluation, we considered evaluation quite broadly to include quite a range of different stages, including just theorizing the intervention and its effect, predicting, i.e., or modeling what the effect might be before you've actually done the intervention, doing the process evaluation, which all the systems approaches really spoke to, doing the intervention and trying to measure the actual impacts of the intervention. So that's different from modeling. This is where you've actually got data on what the intervention's actually done. And perhaps after you've done that, there's a stage where further prediction on how to scale up the intervention or apply it to different contexts is done, so more modeling. And I think that's most of I'm on the two more slides for me. This slide's taken from something I'm working on right now. And I guess I've included this. This is on licensing of private sector landlords. So me and colleagues have been putting together a proposal on how we would do this and the different things we would look at. And with this, I guess I just want to make the point that what we haven't done here is decide to come up with a system map and focus everything we're doing on that map. Rather, we've just used systems thinking to try and think about the intervention and its possible intended and unintended consequences in different ways. And really, here, I think we're just using systems thinking as a way of just broadening out the things we're going to allow ourselves to think about. So we're not, again, we're not just very focused on the intervention and its implementation, but we are more interested in also its wider effects. So we've come up with a bunch of hypotheses that we're going to explore, and they are systemic, even though they're not sort of based around the map. So you don't know exactly what they are from here, but we're interested in whether policy priority, whether if the intervention's effective, that will lead to policies that promote the private rented sector, even though it may not be the best sector for helping people with disadvantages. You know, the social rented sector might be better for doing that, but there's a danger that if an intervention in a particular area is effective, then all the focus might go onto that area. We're interested in things like whether if you improve a geographical area, a place, does that drive up the prices of property in that place? It almost certainly does. So place improvement goes hand in hand with gentrification. We're interested in whether that happens at a home level as well. If you improve a house, does that increase the value and cost of living in that house? And will that also have an impact on people with less money? We're looking at other ways in which costs of the intervention might be passed on to hypotheses. We're interested in whether landlords will just give up and stop renting, and that could lead to evictions. And we're interested in whether, because there's clauses about antisocial behavior, whether this will lead to discrimination or displacement, a kind of spillover effect where antisocial behavior increases in nearby areas because it's being tackled in an area of interest. So I guess my main point is just a way of allowing us to focus on a wider range of issues if we wanted to. This is my final slide. Some thoughts for now. First of all, I want to say that the utility of systems approaches in public health research is still a live issue, and it's not problem free. You get people claiming to have a systems approach when they don't. You sometimes get studies where a systems map and it's all very complex conclusion is the end point, and it's difficult to know what to do with that. Although we think that systems research should help us understand upstream determinants of health, it does often get used in individual level studies. And sometimes systems is used as an excuse for inaction, which Mark Pettiker has written about in a study called Nothing Can Be Done Until Everything is Done. It's very complex, so you can't do the one thing that you think is a good idea because it's too complex for that to solve everything. Is a kind of false argument that's sometimes put up. But we think the systems does offer a way to understand the impacts of upstream interventions in a more sophisticated way. There are many impacts, contextual interactions, changes in delivery and outcomes over time are all things that it helps you understand. I should get off. I think I've been on too long and I'm going to squeeze out Elizabeth's time. So I'm going to stop sharing. Have I talked too long, Elizabeth?
You're good, Matt. We're all set. Thank you very much. I think, yeah, that tees it up quite nicely. Hopefully this is going to move on to present. So as Matt said, when we were reviewing the literature on complex systems approaches and how they've been applied to public health evaluation, one area we thought was somewhat underdeveloped was process evaluation, taking this perspective. So we wanted to delve a little bit more deeply into, looking at studies that have already taken this lens and our understanding of how systems thinking has been applied in other evaluation methods. How can we develop a process evaluation framework from a complex systems perspective? So before diving into that framework, I think it's just useful to kind of explain and see what we think is usually a normal kind of process evaluation. So drawing on the guidance from the MRC that Graham Moore led on, process evaluations are usually utilized to assess the fidelity and quality of implementation, to clarify causal mechanisms of an intervention, and to identify important contextual factors that are associated with the variations in outcome. And so what we saw from our review of the literature and from thinking about what we know more broadly about systems thinking was that we thought that systems thinking and complexity theory could be used as a kind of set of conceptual and methodological tools to guide an evaluation and to move beyond just the immediate kind of implementation of that intervention, the acceptability and the uptake. And what we really saw the value of kind of applying a complex systems perspective to process evaluation was really that it's intended to foreground and kind of forefront the system into which the intervention is introduced. So more, if you will, kind of traditional process evaluation generally takes the intervention as a starting point. And we saw the value of designing a framework that really takes the system as a starting point before we begin to start thinking about intervention impacts. And then with that kind of lens, we want to start to explore what are the nonlinear ways that interventions lead to multiple impacts within systems, and also to very clearly consider both intended and unintended consequences. So we developed a framework for process evaluation from a complex systems perspective. And this is the overview of the framework. I'll go into each of the phases. But I want to take from this kind of initial bit is that the evaluation has a minimum of 2, if not more, phases. And as I said before, the point of the complex systems framework is to really foreground the system. So the entire first phase of this evaluation framework is about generating an understanding of the system, and then using our understanding of that system to begin to think about the ways that an intervention might generate change within the system. And then we can use those questions, those hypotheses, those theories about possible change within the system to guide the subsequent phases of our evaluation. So to dive a little bit more into that, we call our first phase developing a static kind of system description. And we do this, you can choose your different time period, but this might be when at the baseline of the intervention. And so here we're really guided by the questions of what is our system of interest? So that includes making sense of those different elements that make up the system and how they relate to one another, and making sense of the boundaries. So what are we saying is within our system and what is considered outside the scope of our system? And alongside of that, there are judgments to make about whose perspectives get kind of prioritized within the systems, whose get left out. We also want to know in this phase of how does our system behave at its initial time point. So that includes kind of the broad legislative factors and kind of the regulatory environment that shapes kind of the legal rules, but also what are the system norms? What are kind of the patterns and the norms around behavior, and how does that create the behavior that we see in the system? And then once we get that understanding of the system, we begin to start to think about how does the intervention change the system? How might it change the system? And in this phase, there are a range of different methods that we can utilize. One is documentary analysis, which is quite useful for giving us kind of allowing us to get multiple stakeholder perspectives, but we can also do things like interviews and mapping exercises. And from here, what we want to do is identify that system structure. We want to identify those local rules, and we want to identify a range of theories of change or hypotheses about how an intervention creates change. And at the end of this phase one, we're going to have a description and possibly a visualization of the system that would come in a system map, as well as this series of hypotheses about how that intervention may change the system. We then use those outputs, that description of the system and those theories, to develop our phase two research questions. And so here we're really guided by the ways that we think that the intervention might create change within the system. And this is where we then kind of enter a more structured period of data collection, where we have our research questions that are based on those initial hypotheses. And here we're going to draw on a wide range of methods that are dependent on what our actual question is. I think at this stage, what is quite different than several kind of more traditional evaluation approaches is that we need to be very much flexible and kind of open to emergent findings. So we need to kind of build space and agility into our evaluation approach to, when we come across unintended consequences or findings, give ourselves space to explore those. And here we might utilize concepts from the complexity sciences and complexity theory to really make sense of our findings. So where are we finding feedback loops? What is the adaptation and kind of the co-evolution of both the system and the intervention, recognizing that the intervention is unlikely to be static when it's introduced into this dynamic environment, and what sort of outcomes are emerging from our system. And at the end of this, we might be left with an account of the ways in which the intervention embeds within the system and how that intervention and the system adapt and evolve over time. So to make this kind of more live, what I'd like to do is just briefly walk through an example of when we applied this framework to an evaluation of the late night levy. So just a bit of background, alcohol misuse is the largest risk factor for poor health and early mortality in those aged 15 to 49 in the UK, in the UK. This is specifically in England. And local authorities have access to a range of discretionary measures to prevent and address alcohol-associated harms. And one of those discretionary measures is called the late night levy. So if a local authority decides to implement the late night levy, what they do is they charge late night alcohol retailers an additional fee. And then that fee is pooled, and it's used to police and manage the nighttime economy. And this intervention was designed specifically to address social harms around crime, antisocial behavior, and disturbance. So not our traditional health harms in terms of acute, alcohol poisoning or long-term measures associated with alcohol misuse, but it was fundamentally kind of a social intervention. And to date, it's had relatively limited uptake. It's only been taken up in 11 local authorities. But what we wanted to do was evaluate the implementation of the levy in one local authority in London. And there, the revenue was used to fund a new 4-person community safety patrol, so to put new actors, new elements into the system, as well as additional police officers who had a focus specifically on the nighttime economy. And then we applied this two-phase framework of process evaluation to the intervention. And so in phase one, we really looked at the time period just immediately prior to implementation. And what we really wanted to get at here was an understanding of what brought this local authority to choose to implement the levy. What were the factors? What was the way that the system was behaving that made the local authority choose that this was a potentially useful intervention? And then we wanted to make sense of what consists of the actual system and how that system might change in response to the levy. So the way that we did it was we reviewed a wide range of national and local documents. And the local documents, the bulk of them came from a public consultation where there were hundreds and hundreds of submissions about the ways in which stakeholders within the system thought that the levy could create change. And so this was really useful for getting a lot of different perspectives about the intervention. So this included residents in the local area, businesses, organizations that represent those businesses, including pub companies and trade organizations, the police, public health people, etc. So we had a real range of different stakeholders here giving their views on how this intervention might create change. And so from that, we created a system map and a description of the system that showed the ways in which the levy might create change. Then we used those hypotheses about the way that the levy might create change and kind of followed them through the first 2 years of levy implementation. And in this stage, we reviewed local documents that were produced about the levy and what the impact the levy was having within the system and what changes were occurring as a result. And we also did interviews with a range of different stakeholders at the local level that included those that were implementing and delivering the levy. So that included people in alcohol in licensing, the community safety patrols, police, etc., as well as users of the nighttime economy. And then we observed those community safety patrols as they went out overnight and patrolled the local area. And we used those initial theories of change that we identified in our phase 1 of the evaluation to really guide what we did in phase 2. So this is our system map, and we didn't use a formalized group model building approach or anything. We used kind of drew on something from concept mapping, but what we really wanted to do was create an understanding of how the levy first becomes introduced into the system, and then what might happen after it becomes introduced and implemented. And so we have our levy in the middle, and then these green, the 4 different green boxes show our primary theories of change that we identified. Now, only one of these was the hypothesized logic of how the intervention might create change in the system. The other ones were things that stakeholders within the system saw as possible unintended consequences that would stem from the levy. So what I'd like to now do is very briefly go through what each of those theories of change looked like and what we found. So the first theory of change was really about the way in which those that designed the intervention thought the levy might create change within the system. So the argument was that if you introduce the levy, you get additional revenue for policing and managing the nighttime economy, and then you can put more police and community safety people on the streets, which will reduce crime and antisocial behavior. You can also fund more street cleaning, which is going to mean that there's going to be less litter, vomit, etc. on the streets. And so that was the way that the levy was meant to work. But what we also saw was that stakeholders thought there could be other consequences across the system from it, that as you increase police and kind of community safety presence, that it feels like a safer environment, and that's actually going to increase the way that people want to come to this local area and go out in it, which could, for example, increase the reputation of the area, it could drive up customer numbers, it could actually be a boon for businesses if more people want to come to the area. Our second theory of change was one that local stakeholders identified as being a possible negative unintended consequence stemming from the introduction of the levy. And so there was a fear that by introducing the levy, that you might undermine support for public-private partnerships like the Business Improvement District. And business improvement districts are funded with a levy on businesses in the local area. And so the stakeholders that had this view argued that if you were to introduce the late night levy, what would happen is when it came time to renew the Business Improvement District, actually the businesses would say, we can't afford 2 levies, and they would get rid of it. And then that would then have knock-on effects within the local economy because the Business Improvement District funded very important services in the area. And then the last 2 theories of change also spoke to different possible unintended consequences stemming from the levy. So these theories focused around the idea that if a levy were brought in, the businesses would no longer be able to afford operating after midnight. And so they would either then vary their closing hours or shut entirely. And so one possible impact of that would be a reduction in alcohol availability, which from a public health standpoint would be a positive impact. But that was not, as I said before, that was not one of the logics behind the intervention, because it was really designed to address social things like crime and antisocial behavior. But there were also fears that if you curtailed the opening hours, that lots of venues would shut all at the same time. This would kind of push people onto the streets all at midnight, for example, and that would lead to an increase in antisocial behavior, crime, etc. There were also fears that only really large venues would be able to afford the levy, and then this would actually lead to a reduction in the diversity of the nighttime economy offer. So what we would have ultimately is lots of large pubs and clubs staying open, but these kind of smaller independent venues that were potentially less alcohol-led would end up shutting. So just very briefly on then our phase 2. So this is where we took those 4 theories of change and we followed them in the first 2 years following levy implementation. What we found was they raised significant revenue, and in the first 2 years, there was a significant reduction in alcohol-related crimes. And we really were interested in the ways in which this new community safety patrol changed the local system as a new actor within the system. And what we found was there was kind of this new, they created these new information sharing practices between different venues, and they developed new relationships with business owners, which ultimately changed the ways in which venues were managed. In terms of the possible unintended consequences that were stemming from the levy, the Business Improvement District did not fail, but it ultimately expanded, and the services that were provided by the levy were seen as complementary to the Business Improvement District services. And then we did see a pretty big reduction in the premises when changing their hours. So about a quarter of all premises varied their hours to avoid the levy, which we could hypothesize is then again associated with a reduction in alcohol availability. This did lead to a clustering of some closing times, but it wasn't a kind of resultant de facto terminal hour where all premises shut across the local authority at the same hour. And there was no obvious reduction in the nighttime economy. So just to briefly wrap up, so we have a couple minutes for questions. In terms of what I think the value of adding this complex systems kind of lens to evaluation is, I think it's useful for widening out our lens. So in terms of the stakeholders that we think are relevant to an intervention and think, are possibly impacted by interventions, I think it's useful for widening out our boundaries of what we think is part of the system that intervention might create change within, and also that might change the intervention. And I think it pushes us to think about broader change processes and outcomes. I think it is important to be explicit about the approach we're taking and the underpinning theory. As Matt kind of alluded to, systems approaches and complexity theory come from a range of disciplines. And I think it's quite easy to say, oh, I'm taking a systems approach and I want to look at everything. But I think it is useful to be clear about why we're taking it and what theory underpins that. As I hope I've showed with the framework, I think taking a systems lens, it necessitates being somewhat adaptive and flexible and agile in our evaluation and giving ourselves space and scope for following things, kind of outcomes and processes that are not envisaged at the design stage of our evaluation. And I think there's a space for a range of integration of methods that kind of push us to think about different mixed methods approaches. In terms of the process evaluation framework specifically, we designed it with the idea that it would be an overarching structure to guide an evaluation rather than a very, very prescriptive, you should do this, because I think it should be adapted based on the specific context in which you're implementing it. The key to really take away from it is that it foregrounds the system into which intervention is introduced. And so your system becomes the initial analysis point rather than the intervention itself. And it's only after generating that understanding of the system and the rules that govern the kind of the patterns of behavior within the system can we begin to think through the ways that the intervention might create change. I didn't go into this too much in this presentation, but I think it also provides a way of kind of locating your findings within broader systems and where you decide on which boundaries to have within your system. It's helpful to consider where those overlap and nestle within other systems. And Matt brought up at the beginning the new MRC guidance, which points to a range of different theory-driven evaluation approaches and speaks to systems thinking. And hopefully this provides a little more kind of the nuts and bolts and a little bit more of a framework to actually apply that systems thinking in practice to the evaluation. So yeah, that's it for us. There are the links to the systems evaluation guidance and a couple of references. Thank you very much.
Thank you so much, Matt and Elizabeth, for your talks. We have a bit of time for perhaps a couple of questions. So I can see in the Q&A section that there are some questions. So there's one, thank you, Matt, also for responding to one of the questions. One participant has asked, I'd be interested in hearing how systems thinking intersects and overlaps with behavior change theory from a public health perspective. So Matt's put one of your papers in, Elizabeth. I don't know if you have anything to say to that, Elizabeth or Matt.
Just one thing I will say is that we've come at it kind of like the Lancet paper that Harry Rutter wrote from, you know, will this help us do better research on upstream determinants of health? So we haven't gone into the kind of individual behavior change too much, but the other people have, and Elizabeth have found that in the review I put in. The other thing I'd say is that, you know, I sit on a funding panel, and sometimes we get proposals which are very much sort of information-based health promotion. that then claim to be like working within a system. And it's not all that convincing when it's done like that. So if you are going to apply behavioral change within a systems context, I think you've got to be smarter than simply just say, you know, this is a behavioral change intervention and it's part of a big system. There needs to be some more thinking of how to do that.
Thank you, Matt. I think perhaps time for just one more quick question.
I can stay a bit longer, by the way, if anybody else can, but I know that people have got diaries to fill.
Sure, thank you, Matt. So last question, to what extent are systems approaches a move away from methodologies that establish causality? And if they are a move away, is this a problem? Matt or Elizabeth?
Matt, do you want? I'll dive in first, then maybe you come after me. So yeah, I don't think that it's necessarily a move away from it, but I think it's about thinking about causality in different ways and not always thinking about them as linear chains of cause and effect. But I think taking a systems lens doesn't always mean not using traditional approaches. And I think a really nice example of this is the sugar drinks industry levy, where a systemic lens was taken to kind of broaden out the view of what possible changes might occur after the implementation of said levy. But then more traditional kind of methods, if you will, like time series analyses were utilized to actually analyze the data. So I don't think that they are necessarily at odds with one another, but I do think a systems approach pushes us to think less about linear causes of change and effect and brings in things like feedback loops that Matt really spoke to.
Okay, thank you so much.